Tolac, trial of labor after cesarean section. What is Tolac? A Tolac is an attempt to have vaginal birth after cesarean delivery. Is it Tolac or Vbac? Let me show you the difference between Tolac and Vbac. Tolac, as we said, is an attempt of vaginal birth in a woman with previous cesarean section, while Vbac is a successful outcome of Tolac. So, can I allow all women with previous cesarean section to deliver vaginally? Just a second. Not all women with previous cesarean section can deliver vaginally. Here are the requirements for Tolac. The uterine incision must be low transverse incision. We usually allow only one prior cesarean section. And the reason for a previous cesarean section must be non-reoccurring reason. There shouldn't be a history of uterine rupture and no other medical conditions that may prevent vaginal birth. So, if no risk factors, and it was a single previous section with a low transverse incision, then Tolac is going to be successful in 60 to 80%. And there are predictive factors for success. The most important factor is a prior vaginal delivery. Also, spontaneous onset of labor, a maternal age below 40s, uncomplicated pregnancy, fetal weight below 4 kg, and a non-recurring indication for cesarean section. And here are the contraindications for Tolac. It includes classical or inverted T uterine incision, a prior uterine rupture, extensive uterine surgery, and finally contraindications to vaginal delivery. And you should remember that the pillars for Tolac are risk assessment, counseling, and shared decision making. And if you're going to perform a Tolac, you have to stick to the best practice for safety. Starting with facility requirements, the facility should be capable of providing an emergency cesarean section. There should be also continuous electronic fetal monitoring, and this is the most reliable way to detect fetal status. It may also detect uterine rupture. And regarding labor augmentation and induction, induction is not contraindicated, but it slightly increases the risk of uterine rupture. And for oxytocin, it's safe for both augmentation and induction, but it should be used cautiously. And for cervical ripening, mechanical methods are considered safe, while prostaglandins are better avoided. The labor curve for Tolac patients is just similar to that for non-leprous women. And if you want to use epidural analgesia, it's not contraindicated. You may use it as it doesn't appear to mask the signs for uterine rupture. How to suspect uterine rupture during Tolac? The signs of uterine rupture includes a sudden non-reassuring CTG, an acute onset of severe abdominal pain, sudden vaginal bleeding or loss of fetal station. And we should respond immediately by preparing for an emergency cesarean section and ensuring that the whole resuscitation team are notified. Now, the benefits of a successful Tolac are shorter recovery time, lower risk of infection and blood loss, avoidance of major abdominal surgery, lower risk of complications in future pregnancies, especially abnormal placental development. While the risks include uterine rupture, which is the most significant and most serious, also emergency cesarean section, maternal and fetal morbidity if failed Tolac. To sum up, Tolac is a safe and reasonable option for the majority of women with prior low transverse cesarean delivery. The decision is highly personal and should be based on an unbiased discussion of the patient's individual risks and benefits. Promoting safe Tolac is a key strategy for reducing the overall cesarean delivery rate and its associated maternal morbidity and long-term complications. For healthcare teams, this requires a collaborative approach involving patient counseling, strict adherence to institutional protocols, and rapid emergency response capabilities. Thank you.